All right, let's start. Hiya, I'm Jude, birth obstetrician, gynecologist, and fertility specialist. I'm with Lara and Tamika from Mercy Physiology. So I'll let you talk about what you do to start with.
Yes, so I'm Lara. I'm one of the women's health physiotherapists here. So I've got an interest in women's health. I've been practicing women's health for the past 5 years and a physio for 8 years. So I've done my masters, specialising in women's health, and that's what I enjoy treating. So anyone with kind of any pelvic floor, bladder, bowel issues, or pregnancy conditions, or anything postnatal, that's kind of my area of interest.
Interesting.
My name's Tamika. I'm a physiotherapist as well. So my background or main interest, I guess, is musculoskeletal physiotherapy. So I treat a lot of muscle and tendon problems, do a little bit of post-surgical rehab stuff as well. And since moving here to Mercy Physiotherapy, I guess I've been exposed to the women's health and the pregnancy side of things as well, which has really given me an interest in this side of things. So I treat a lot of low back pain with pregnancy, pelvic girdle pain, and a few other associated problems such as wrist pain and carpal tunnel, those type of things. So yeah, that's me.
Well done. So as you can see, they're going to let us enlighten us with physio in pregnancy.
Go.
Good afternoon, I'm Teoh, obstetrician, gynecologist, and fertility specialist in Perth. Before we go any further, I'm gonna give you a little game. It's just to guess the ingredient. I'm kind of looking for snacks made up with healthier ingredients lately, and I went to this shop actually. Let me see the name of the shop in Vic Park. It's called Loose Produce Whole Food Grocer. So they bought a few chocolate balls, as you can see. I think they look chocolatey to me to start with. Yeah, we can have a taste and you let me know what's inside, and we can let's.
Sure. Thank you.
Thanks.
Yeah, we can put it back in. It's a big one. Don't have to finish it all. Okay, Phil. It's not bad actually. Just not, I think. Not too sweet.
No.
So, what's inside? I'm looking at my list.
Coconut.
Coconut. Yep.
Yeah, we do have coconut. Well done.
Dates.
Yeah, I think
Yep.
dates. Some kind of nut. I think almond maybe, or maybe some nuts in there.
There's nuts.
Maybe not.
Peanut.
Maybe it's the coconut.
Is it peanuts?
It says sunflower seeds.
Oh, there's seeds. Okay, right.
So quite healthy, I think. That one.
Okay. There's like chocolate.
So cacao.
Cacao.
They didn't say chocolate here,
Or
but
chocolate,
I'm sure there's
yeah.
a chocolate
Well,
there. You
looks
can
like
see it on the
there's
outside.
chocolate.
And I feel like there's some kind of there's something red and sweet, like it's nice tartness to it.
Is it a berry?
Berry, some kind of
Yep,
dried
well done.
berry.
Frozen raspberries.
Oh, yum.
Okay. Yep.
And dates, you're right.
Mhm.
It's on fire.
Honey?
No,
No.
not here.
Okay. I'm just thinking I'm gonna be sticking it together.
I'm not sure.
And yeah, I thought you mentioned dates. Well done.
Yep.
And pepitas
Oh,
and dried cherries.
Dried cherries.
And the oil they use coconut oil. You need to use some oil.
Yeah.
To
of
hold it
course.
together.
You know, yeah. So just like any snacks, I guess, eat in moderation.
Yeah.
But I find ingredients is probably healthier with in
Yeah,
comparison
better
to some of the other snacks.
Definitely.
Not bad.
So I promise I bought them. By the way, I didn't get it for free. Just a loose produce. I thought I promised them I'll show their branding, which is pretty cool in Vic Park. Now move on to our main. We made notes, haven't we?
Yes.
So very formal. So as you can see, pregnancy. Like myself, I see pregnant patients every day, and exercise and physio is a very important part. We can start with preventing problems. I often encourage them to exercise. I think that would maintain excessive weight gain, and also control their blood sugars, prevent diabetes, and also you want a strong integrity of the muscles to prepare for childbirth and everything. But let you start. In pregnancy, what what input can you give to prevent or to treat problems?
So in terms of Tamika and I would see a large population with low back and pelvic girdle pain. So pain in pregnancy can be caused by the hormones affecting the tissue sensitivity. So the tissue can become more sensitive, and as bub gets bigger, the extra weight can put extra strain through the muscles and joints. So we often see lower back and pelvic girdle pain. So it's high. There's higher risk in those who have actually had lower back pain in the past, or are hypermobile. So helping to keep nice and strong is really important. From a hands-on point of view, though, although this kind of pain's quite understandable, it doesn't mean that it should affect your life and affect your daily function and quality of life. So often we can help you out with some hands-on treatment. So that might be things like massage, dry needling. It might be prescription of things like support belts. So for pelvic girdle pain, might be a support belt.
Yeah.
And then it might, of course, include exercise as well. So exercises might be done at home. It might be changing how you move in case that's contributing to the pain, or it might be actually attending an exercise class specifically. We'd also give support belts for those who get carpal tunnel or splits there.
Yeah.
So
I think there's some sample there.
That's the wrist splint.
Yeah,
For
so that
carpal
can be
tunnel.
helpful for carpal tunnel. So if you're getting any swelling, tingling, pins and needles, often a brace can be a place to start.
Okay, but would you advise patients to get help from very early on, or kind of cope and then get help a bit later on?
Although pain's understandable, generally getting into good habits, I'd say, from the start can be helpful, because if it's changing movement patterns that can contribute to the pain, the pain has a potential to get worse. But sometimes, depending on other factors, things like even sleep and stress can wind up your pain system. So, but just knowing those factors and getting into good habits and active management strategies from the start would be helpful. So
beautiful. Yeah, beautiful. Yeah, as you know, guys, it's part of the teamwork. Often I give patients very general advice on how to prevent pain, or to measures to prevent pain from getting worse. But I do ask help from physios like Lara and Tamika very often to help my patients to cope with back pain, wrist pain from carpal tunnel, etc. So well done. And we're going to talk about the exercise classes as well.
Yes,
you're getting excited.
We do offer a range of exercise classes here at Mercy Physiotherapy. I guess just to take note of first, there is good research out there saying that exercising throughout your pregnancy can help a lot with your lower back pain as well as pelvic girdle pain as well. So starting that, like you just said, starting soon is better than starting later, if there is pain around as well. It can also just help you cope a little bit better with your labour as well as the delivery and recovery afterwards as well. So starting that as soon as possible can be good. So yeah, we have a few different types of exercise classes here, all run by physiotherapists, which we all have experience in the women's health area as well. So they're all low impact exercises as well. So what we mean by that is safe for the pelvic floor muscles, so safe for abdominal muscles, as well as safe if you are getting a little bit of lower back pain or pelvic girdle pain as well. Worth noting, we can modify everything as well for the individual patient. All we do ask is that we just either check with yourself like an obstetrician or a GP just to check that exercising is safe. And also as well, our classes are welcome to, anyone can do them. Any pregnant lady can do them. You don't have to be delivering here at Mercy, at the hospital here to join in our classes. So that's also beneficial for a lot of women as well. So we have a pool class to start off with as well, which can be really, really helpful to get into the water and exercise, particularly as you're getting a little bit bigger and towards the later stages of your pregnancy as well. It's really nice just to hop in the water, take all the pressure off your back and your hips and your pelvis. The water's at a really nice temperature as well, which can feel quite nice in the water. It can also help a little bit with swelling through your hands and your feet as well. That's another common problem that we see.
Yeah, I think it's a myth. I've heard pregnant patients say, oh, you know, they're pregnant, shouldn't be swimming, but I say,
Mm.
look, that's wrong. It's
No.
a total
Wow.
myth, isn't it?
Yeah.
I say, look,
Great. I think
it's the best, one of the best
best
things
things
you
you
can
can do.
Absolutely,
Yes,
absolutely.
yeah,
I do
which
agree.
is-
We've seen a few heavily pregnant patients early on walking
Yeah,
by.
Yeah.
no,
Really
often
excited.
I think that's the best thing they can do when
Yeah.
they're that big and uncomfortable. Get into
Yeah.
the water, even if it's just floating around in the water. At
Yeah.
least it's, you know, half an hour
Yeah.
of you know, comfort,
Taking
the
the
pressure
pressure
off,
off.
and,
Yeah.
and pain relief, which can be really nice.
Good, alright, change direction, change. One, three, so the arms.
The other ones that we do have are like Pilates classes in the gym area here.
Yep.
Great for strengthening, flexibility, posture as well,
Mhm.
can be very, very helpful. And then our gym circuit classes as well. So we focus a little bit more, bit of cardio exercise, so getting the heart rate
Wow.
up slightly, as well as strengthening exercises for the upper limbs, lower limbs. And that can really prepare you for afterwards as well. So holding a baby and that repetitive lifting, we see a lot of
Wow.
neck and shoulder problems with that afterwards. So addressing that beforehand, whilst you're pregnant, can be helpful.
Sure.
Yeah.
Can you briefly mention what kind of modification do you
Mhm.
do for
With exercise?
with pregnant and non-pregnant? Say, look, you know,
Yeah,
you
yep,
do. Let's
yep.
say you do circuits with
Yep.
non-pregnant patients coming in, and the next
Mhm.
set is pregnant patients.
Yep, yep.
What would be the difference between your circuits?
Yeah, so with pregnancy, we often try and make everything as bilateral as possible. So we try and avoid lots of single leg activity
Sure.
or positions where your pelvis is not in a good, I guess, alignment or not straightforward. So twisting, you know, having one leg forward, one leg back, we try and avoid too much of that or
Yeah.
too much pressing through one side of the pelvis,
Sure.
as it can get pretty uncomfortable around your hips.
Yeah.
I think as well it's just the weight you're lifting and
Yeah.
what you're pushing and pulling, you know.
Yeah.
Only light weights, we stick with light weights for the pregnancy ones, and with your cardio you're not pushing yourself too much. So we
Yeah.
do want to get your heart rate up slightly,
Sure.
but definitely not, you know, huffing, puffing, sweating,
Yeah.
just so that you can hold a conversation, but it's just starting to get a little bit tricky.
I think.
Yeah.
Yeah.
And from the abdominal point of view, of course, your tummy muscles are stretching in pregnancy, so definitely the load is very different antenatally to postnatally, whereas it's a hint of tummy in pregnancy in good posture. However, postnatally we want to strengthen and help those muscles recover. And integrating pelvic floor both antenatally and postnatally as appropriate
Well
is
done.
also
Yeah.
helpful.
And often, you know, from our point of view, placenta releasing this hormone relaxin that makes you meant to open up the birth canal to
Yes,
deliver
of
for
the
natural
tissues.
birth. But all the joints will be a bit loose as well. Isn't it? Is
Yeah,
that
so it
something
affects
should-
all the joints. It's not
Yeah.
just the pelvis. Your feet
Sure.
can get flatter because they relax, the arches relax
Well
and
done.
things.
Well done. So nature can't choose us which
No.
which
Which
joints
joints
to work. You know.
specifically.
No.
Everything is loosened.
Go.
Right. Looking at the last point. Is it the last point?
Yeah,
Yeah.
yeah.
Quick and easy. Now, PFE, pelvic floor exercises, one of the
Yes.
hot topics.
Yes.
So I'll let you talk a little bit more about it.
Yes, so in pregnancy, generally we want to start to help as the tissues are softening, everything's relaxing to help with the birthing process. Holding 5 kilos of weight starts to double the amount of pressure through pelvic floor. So to help with the late stages, to help prevent leakage when you add another pressure into that of coughing or sneezing, we often want to help you start with pelvic floor. About a third of women can practice pelvic floor incorrectly. So one of the advantages and one of the things we can check for is actually using ultrasound. So same technology as you look at your babies with, except for we look at the bladder. If the bladder actually lifts up on the screen when you do a pelvic floor contraction, you're doing it properly. If it drops down when you relax, it means you're relaxing, and that allows us to prescribe a strength-based exercise program. However, some women actually need to relax more, so we can individualize those exercises. And looking after good bladder and bowel habits is also important because that can contribute to pelvic floor issues. And we can also advise on safe abdominal exercises as well as safe exercises for pregnancy if you're doing not the specific antenatal classes.
Well done. When do ladies, when you're pregnant, when do they need to worry about pelvic floor exercise?
Look, generally about 21 weeks you want to start to perform your exercise. It does depend on, because some people have too tighter muscles, or some women actually need to generally do more strengthening towards the end. But generally about halfway you consider starting. Generally looking at starting with like just to tighten and let go, and focusing on the sensation, making sure you can feel that before you progress. How many seconds hold for, how many repetitions, depending if you need to get stronger or just let go.
Well done. Anything else like to add for this time?
Just if anyone has any questions at all, feel free to give us a call or send us an email. You can visit our website at www.mercyphysio.com.au, and we're located on the lower ground floor of St John of God, Mount Lawley, if you wanted to pop in.
Well done. I think we should conclude this time.
Yeah.
The physios from Mercy Physiotherapy. All right, well done. I'm going to turn it off.